Good morning.
Morning.
So I couldn't join on my laptop. I had to grab my tablet for some reason.
That's all right. It looks like it works just fine.
Yeah.
And just so you know, Sue, we are recording right now.
I'm sorry, what?
We're recording right now.
Oh, okay. Perfect.
Morning, Connie.
Morning.
Yeah, the only early birds.
Good morning, everyone. We'll get started in a few minutes. While we're waiting, please enter your name into the chat box. And if you're new to our meetings, please enter your agency and email as well into the chat box.
Hi, this is Kelly Oliver. I'm actually just over the phone because I'm at work at Franciscan and I couldn't get Zoom to work on my computer, but I am here.
Perfect. No problem at all. Thank you for joining us.
Thank you.
Hi, everyone. For those who just joined us, please enter your name into the chat box so we know you're here. And if you are new to the coalition, please also enter your agency and email. Thank you. We'll get started in just a few minutes. All right, everyone, we will get started for the sake of everyone's time. Just so you all know, this meeting is being recorded, so please keep yourselves muted until it's time to introduce yourselves. So welcome, everyone. We want to thank you so much for joining us today for our second virtual coalition meeting. And for the sake of time, we'll just jump right into our agenda. So I wanted to provide a brief summary of the survey results from the first survey I sent you all following our first virtual meeting. And the goal of that survey was to get to know all of you and what you all want out of this coalition. So diving deeper into that survey, the second Wednesday of the month at 10 a.m. worked the best for the majority of you to have our monthly meetings. And when asked what are your priority areas, the top 5 responses, starting with the area that most of you work on, are mental health, then education, then public health, then healthcare, and then advocacy and policy. So there's quite a variety of backgrounds in our coalition, which is really great. And then when we asked which topics and trainings you'd be interested in, the top 5 responses were cultural competency, then mental health first aid, then health equity versus equality, then social determinants of health, and then social justice. And we are going to be working on making sure to incorporate all of your interests into our future meetings. So stay tuned for that. And then when we asked you how you receive your media, the top 3 media outlets were social media was number 1, and then TV, and then radio. And then finally, we asked if anyone would be interested in being a part of a tobacco prevention and cessation focused work group. And we did get 6 individuals interested so far. So thank you to those who did express your interest. If you didn't get a chance to, you can email me because we're always recruiting for that. And you might have noticed that I sent out another survey. So we're still collecting responses on that. And it was more regarding tobacco prevention and cessation. So if you haven't already completed it, please do so. It'll help us on our grant application. And we will let you know the responses to that in our next meeting. So now we will move on to introductions and sharing. So starting with the Healthy Communities staff, and then I will call on each of you to introduce yourselves as well. So I'll go ahead and start. So my name is Melina Rivera. I'm the Tobacco Program Coordinator for Healthy Communities. And I just wanted to tell you a little bit about what I do here at Healthy Communities. I do tobacco prevention and cessation work. So I refer clients to the Indiana Tobacco Quitline program. I enroll employers, healthcare providers, and organizations into the Quit Now Preferred Network, which enables them to support their employees, patients, and clients in quitting and getting them referred into the Tobacco Quitline. I also help work sites, schools, and multi-unit housing become smoke-free and maintain their smoke-free policies. And then I can also do presentations on the Tobacco Quitline or any tobacco-related topics So feel free to reach out to me if you're interested in a presentation. And then my update for you all is that we are now in the middle of renewing our tobacco prevention and cessation grant for the 2021 to 2023 grant cycle. And if anyone is interested in reviewing our work plan for it, please let me know. But I will stop there and pass it to Sue.
Good morning, everybody. Sue Reed. I'm the Executive Director for Healthy Communities. And not only do I get to work beside these awesome ladies, Melina and Connie, who you'll meet in a moment, I get to do a lot of the advocacy work for Healthy Communities. So we've recently have been advocating for the increase on the cigarette tax to be $2 per pack versus 50 cents, which I'm not sure exactly where that's at now in the Senate. But I also do a lot of the networking in the community, and I look forward to working with you and getting to meet all of you. Connie?
Good morning, everybody. My name is Connie Brond. I have two roles here at Healthy Communities. One is the enrollment or outreach and enrollment specialist for Covering Kids and Family. If you didn't know, Covering Kids and Family is a statewide organization that helps anyone in need of health insurance, whether it be any Medicaid program or the marketplace. It is free, unbiased assistance to educate and enroll people into health insurance, and even way after the initial application, if assistance is needed. We are happy to say that here at Healthy Communities, we have an 84 enrollment rate into coverage of all applications, when 80% is what the goal is from the whole state. So that's really good. And currently the federal government insisted on an additional special enrollment period for the marketplace from February 15th through May 15th to help with the losses of the pandemic. So that's also really good. My other role is the Youth Tobacco Coordinator. I am the adult ally for Voice. Voice is Indiana's statewide youth empowerment program, whose initiative is to engage, educate, and empower teens to promote and celebrate tobacco-free lifestyles. Every 1 in 4 high school students vape, and every 1 in 20 middle school students vape in the whole state of Indiana. Currently, I am looking to recruit young people ages 13 to 18 to be a part of this great opportunity that Voice has to offer, which includes developing their leadership skills, build their resumes for college and the workforce, and to get that community hours and even way more than that. I do have good news. We are going to be starting in-person events this spring, summer. I am thinking in April, not sure on the date yet. We will be hosting a recruitment event. It will be in the evening around 5 p.m. for about 2 hours, food possibly provided. So if any of you know a place that can house up to 20 young people safely and social distancing, please let me know. Please email me. I will provide my email in the chat. And that's all for me.
Awesome. So now we will move on to all of you. I will call on you, and please just tell us your name, agency, position, and any updates you'd like to share from your agencies. So let's start with Tamika Saunders.
Good morning. As you said, my name is Tamika. I am a community relations specialist for United Healthcare. I'm excited to let everybody know United Healthcare is entering Indiana as a Medicaid option for the Hoosier Care Connect population, which is the aged, blind, disabled, foster care communities as well. Like I said, that'll start beginning of April. And I'm looking forward to joining to being a part of the coalition and supporting agencies with sponsorships, donations, and providing health coverage to your clients and patients.
Great, thank you so much.
Thanks.
Kelly Oliver.
Hello, I'm Kelly, and I'm a nurse over at Franciscan Health. I'm actually at Woodland Cancer Care Center. I am the new lung nurse navigator at the Cancer Care Center, and I also follow patients at the hospital too. The other part of my job is to be the Aspire coordinator. I'm not sure if all of you know, Franciscan has a smoking cessation program called Aspire that's already up and running in Crown Point in Indianapolis. And it is now my duty to get that up and running here in Michigan City. So I don't really have any updates right now because I did just start last month. But once that gets going, I'm sure I'll be giving you guys some updates and probably recruiting some help and information from you all. But it's nice meeting you all.
Nice meeting you, Kelly. We'll go with Jennifer Carroll.
RA, which I haven't really seen one of ever.
Hi, I'm Jennifer Carroll. My icon, it says Deborah Briggs, but I'm just using her laptop to join you. And I'm a social worker at the Open Door Adolescent Health Center at the Michigan City High School. And we are plugging along, providing free services, health services, and mental health services to the students that are registered with us at the Michigan City High School.
Awesome. Lacey Pullman.
Good morning. My name is Lacey Pullman. I am with Early Learning Connections through Geminis. I am one of the community engagement specialists. Just an update for us. We are getting ready to roll out our Week of the Young Child, which will be April 12th through the 16th. We do have an activity sheet. I can forward that on to you all, that we're just asking families and their children to kind of, create a picture, an activity of like what togetherness with their family looks like. And we're going to do raffles throughout our, 10 counties that we do cover. So I will be sure to send all that information again on to you guys. And thank you for having me.
Thank you. Joachima Doss.
Good morning, everybody. I am Jakima Doss, and I'm with CareSource, and I'm the manager of community marketing. CareSource is one of the 4 MCEs that are currently across the state providing services for Medicaid, Marketplace, and Medicare Advantage.
Awesome. Jennifer Heath.
Okay, hi, I'm Jenny Heath with Swanson Center. I'm the director for our Foundation for Behavioral Health, but I also serve in a marketing capacity for the agency. We are the designated community mental health center for LaPorte County.
Great. Monica Cavender.
Good morning, everyone. Like Tamika, I'm new to the coalition. I used to attend meetings about 3 years ago and was actually part of Healthy Communities. So it's really neat to see that everything is still going strong, and even stronger, it seems. You guys have really built everything up. So I'm proud and thankful for that. So yeah, I actually was program director for CKF about probably 6-7 years ago. And currently I am project manager with Indiana Wellness Consultants. So like Tamika, I'll be working on the United Healthcare project now that they're starting up the Hoosier Care Connect program for the state of Indiana. Like the other MCEs, we'll be providing special programs and opportunities for collaboration. United Healthcare is specifically managing Hoosier Care Connect. So they're not yet in HIP and Hoosier Health-wise. So just something to keep in mind as you meet clients or are dealing with the community and they need services relating to the disabled, blind, aged, and also families in foster care. So I think that's probably it for now. More to come. And I would definitely, Melina, appreciate the opportunity to maybe present to the group Eventually, I will fall back and Tamika will take the lead, but it would just be really neat to get to know everybody. Also have separate meetings with you all to see how we can support.
Absolutely. Thank you so much. I will reach out to you. Nakia Bonds.
I'm sorry, I was trying to get off of mute. Okay, hello everyone. I am the member liaison for the Anthem Medicaid programs, and we are in the Healthy Indiana Plan, Hoosier Healthwise, and Hoosier Care Connect. I am like the point person. So if you're working with members who are on Anthem and they have issues with using their coverage or just have questions about the different programs that we offer, then I would be that contact. You may see other folks out in the community representing Anthem that serve in different roles, like Chantel Johnson, she's on the marketing outreach side. Brittany Pickett, she's a PA, I forget what her role is, what that stands for, but she's also on our team and we work closely together. Right now, we are working with the state to assist with scheduling COVID vaccines. So if you're working with someone and 211, that whole wait time sometimes can be a little long, we can go ahead and get that scheduled for them pretty quickly. So definitely connect with me if that's something you're interested in.
Thank you. Ebony Neal.
Hi, I'm Ebony Neal. I am the Family Resource Specialist for the Healthy Family Program at Dunebrook. Dunebrook service the Healthy Families Program out of LaPorte County. We really are just a program based on supporting parents that are either prenatal or just had a new baby under 90 days old. We offer things like information on child growth and development. We promote positive parent-child interactions. We have things like pack and plays available if you know of anybody that needs a safe place to sleep for their baby, and also other baby items and just a wide variety of things. Dunebrook also has a new program up and running. It's called the Parent and Family Education Program. So if you know anyone that like a captured audience that needs parenting classes, it's based off of a program called Nurturing Parenting. You could just contact Dunebrook or contact Jeannie Ann and we can set something up that way.
Perfect, thank you. Abby May.
Hi, I'm Abby May. I am the program director for Michigan City Area Schools Safe Harbor. We're the longest running out of school time 21st Century Community Learning Center program in Indiana. We serve after school programming at 9 of the 11 Michigan City area schools and before school programming at 5 of the schools. The after school program as a 21st Century Community Learning Center is rooted in academic enrichment and cultural enrichment. There's a common misconception that after school programs are all aftercare, and that is definitely not the case with Safe Harbor. Our performance measures are academically driven and focus on social emotional needs and is fully data driven. We also run the Hours for Hours mentor program through Michigan City area schools, where we match community volunteers with students seeking one-on-one and small group mentoring. And we run the Michigan City High School robotics team, as well as a robotics feeder program starting from lower elementary, going all the way through high school with a internationally competitive high school team.
That is awesome. Thank you, Abby. Denise Beck.
Hi, good morning. My name is Denise, and I am the community health worker with HealthLink in Michigan City. Basically, in my position, I help to address any social determinants of health that patients may be facing, and also help them work on health-related goals. And I also work with a Indiana State Department of Health program called Pivot.
Thank you. All right. Let's see, Shannon Walker.
Good morning, everyone. I'm Shannon Walker with Community Foundation of LaPorte County. Just here, just listening and learning and just staying connected with everyone. Glad to be a partner with you in all these efforts. Just for everyone's information, Unity's continuing Vibrant Communities updates. So you can go to vibrantlpcounty.com and there's tons of updates and great resources for you. And also just be aware, we will open our Power for Good grants program beginning May 10th. And July 23rd will be the deadline. So just keep that on your radar. We'll be getting communication out about that, but those are $3,000 grants and organizations can apply for 2 different grants per cycle. So just keep it on your radar. Glad to be a part of this morning. Thank you.
Great, thank you. Susan Enamorado.
Sorry about that. There was a little delay to get myself unmuted. So I am right now in the HealthLink building in Michigan City. I'm here in this office Tuesday, Wednesday, Thursday each week, unless I have other obligations or appointments. And on Mondays, I have an office at MHPLC, Minority Health of Partners of LaPorte County, in the trustee's office, the Michigan Township Trustees Building. I'm a doula and community health worker for Indiana Minority Health Coalition. It's a network of coalitions from across the state that deal with any health issues where there's a disproportionate impact on minorities, and specifically Latinos, African Americans, and Native Americans. So there are coalitions working on smoking cessation, right now on vaccine, having access to vaccines, just anything related to health and disproportionate impacts. The doula services is the only community-based doula service program in Indiana. Our services are free to all of our clients. Right now, statewide, we're working on a bill that didn't pass, but may pass in the future to extend the Medicaid coverage for women after they give birth from 6 weeks to a year. Also working on women who are imprisoned and giving birth. Right now, Indiana is one of very few states that allows them to be shackled during labor. So there are a number of issues related to childbirth. Here in Michigan City, this week we'll be doing door-to-door outreach at Lakeland Estates, because we're also doing outreach for vaccine access at Lakeland Estates. We're going to be combining that with doula access as well. Trying to get the word out. And so if there's a way I can drop off paper flyers for our program, you know, any place where you have young people, the programs that have just presented about the work that you're doing with young people in the schools or in the community. We're trying to get the word about our program out. Childbirth is one of the areas where Indiana is close to the bottom and has been close to the bottom of the 50 states in terms of maternal mortality and infant mortality. And so this program is funded by the Indiana State Department of Health, and our target audience again is those that are disproportionately impacted. Thank you.
Thank you, Susan. Let's see, Dawn Weigel.
Good morning. I work at the LaPorte County WIC office. I am the site manager here. We are still doing everything over the telephone. We're in the offices, so if anybody needs to call, are still setting up new clients and getting everybody their benefits over the phone, and it's working well. We have a waiver through May 20th, but from there we don't know what's going to happen, if we're going to be opening or still doing everything over the phone.
Thank you, Dawn. And I think we have one more, Amina Starks.
Hi, I'm Amina Starks. I'm the Assistant Director for the Otis R. Bowen Center. We offer skills coaching services for children and adults ages 3 and up. And we can basically provide coaching services around anxiety, depression, really any mental health issue. And we do have a waiting list, so that's always good.
Awesome. Thank you, Amina. All right, I believe that was everyone. Is there anybody that I missed? Okay. Thank you all so much for sharing. All right, I'm going to pass it to Connie.
All right, thank you everybody for sharing your updates and information. That is why actually we here at Healthy Communities have decided it would be a great idea to create a monthly newsletter for the coalition to make sure events, any updates, any other information you may want to share to be distributed to everyone here. So, you know, this will be a great resource for you guys. All events, updates, etc. for this first newsletter will need to be submitted to me via email no later than March 18th. Again, I did drop my email into the chat box, but I'll do it again if need be. This month's newsletter will be released March 24th, so you all know. The future newsletters will have a similar submission date and release date. Submit by 1 week after coalition meeting, and the newsletter will be released about 2 weeks after this coalition meetings, give or take. So sounds great, right? The more participation, the better the news. So let's read all about it.
Yay. Thank you, Connie. All right, so we are actually wrapping up now pretty early. I did just want to let you all know that in our next meeting, we will have a guest speaker who is a cultural and linguistic coordinator from the Family and Social Services Administration through their Indiana System of Care team. And she will be providing us with a mini cultural competency training. So that is something to look forward to next month. So our next meeting is Wednesday, April 14th at 10 a.m. And I hope to see you all there. And that's it for us. If anybody has any questions or wants to chat, we'll stay on a few extra minutes. If not, you guys can jump off. Thank you, guys.
Thank you all. Have a good day.
Bye. Have a good day, everybody.
Thank you. Bye-bye.
I was just wondering if I could get an invitation sent directly to my email. I actually am using the invitation from our outreach coordinator, Liz, here at HealthLink.
Sure.
Should I put my email in the chat? Would that be the best way?
Yep. Just put it in there, and I'll add you to our outreach list.
Okay, very good. Thank you.
Thank you.
I was just wondering, do any of you have any upcoming events? Obviously virtual for now. It looks like maybe in the spring, some of us are going to start to get out there. But just wondering what that looks like for you all at the moment.
I know I'm going to be a part of a big virtual game night on April 1st. For a recruitment event for Voice. It's for Randolph County District Schools, but she collaborated with 5 different adult allies around the counties that don't have core team members yet to recruit virtually these youth from Randolph County that doesn't have any adult ally in that county.
Do you know if, you know, a lot of times, unfortunately, you know, youth issues are related to foster care type background. And so I was just wondering, do you know if maybe there's opportunity there for United Healthcare to help in some way? You know, because that would be a way if it's lending itself somehow to the population that we're serving, maybe I can help.
Yeah, I'm not sure, but I can definitely get the information out to them and make it part of the presentation or questions about it.
Yeah.
Okay.
Yeah,
Yeah,
Connie. Sorry, Connie reaches out to our local schools, so we can probably get a hold of a representative who has like foster care information, and we could definitely recruit that way and see if we can, you know, get you in touch with them as well.
oh, that would be great. And also, you do not necessarily have to be aged. You can be a child that's blind, disabled. So if through the schools, maybe the nurses, I would imagine, you know, obviously they're aware of the kids they're working with. Not all parents realize that if you have Medicaid, you can actually have a plan that gives you all this other stuff. So that just might be interesting. I know I had no knowledge of it until I actually started working in this field. So
Yeah, that would be awesome.
okay,
We'll definitely reach out to you, Monica.
thanks, and thanks, Connie.
Anybody else have questions or comments? All right. Well, we will hop off then. We'll see you guys in April.
Okay, thank you.
Thank you.
Bye.
Bye-bye.